Hello and welcome to another episode of BSM TV. I'm Jim Roddy, the president of Business Solutions Magazine. Thank you for joining us today. We're on the road again at the Smart VAR Healthcare Summit in Dallas, Texas. The Smart VAR Healthcare Summit is powered by ScanSource and Business Solutions Magazine. Our special guest today is Ken Congdon. He's the chief editor of Health IT Outcomes. Hello, Ken.
Hey, Jim. How are you?
Really good. Always good to talk to you. A couple questions for you. First, can you talk about, this is a reseller conference all about healthcare. What are the biggest opportunities that you're seeing in healthcare for resellers?
Well, there's quite a bit of opportunity out there for resellers in the healthcare market. Healthcare as a technology market is growing by leaps and bounds, particularly over the past few years. But to tell you the truth, I'm going to focus not specifically on technologies, but at specific audiences within the healthcare market that I think are ripe for the picking for value-added resellers and systems integrators. And that's the small to mid-sized community hospital market and the group practice or independent physician market. In my opinion, those markets are really in need of IT expertise. A lot of the larger health systems have robust IT infrastructures and personnel, but that's an area where a lot of these smaller hospitals and independent physician practices lack resources. So they're looking for help and support. So if a VAR value-added reseller, systems integrator can come in and really give those folks the support they need in terms of understanding their IT needs and linking and integrating different systems together to streamline workflows, for example, they can really add value to a healthcare facility that's much needed at this point in time.
I'm just curious, it's 2015, and so everybody has a phone and so many things are digitized. Is it just that those smaller practices are lagging behind? Is that what it is? Like maybe they're stuck in the past because it's so hard to switch? Or what's the trend behind that?
To me, it all comes down to resources. So a lot of the smaller hospitals and the group practices are required to meet these same mandates and standards that the federal government is pushing forward for the whole healthcare industry. So larger health systems have an easier time doing that because they can afford to hire more IT staff or hire folks to come in and dedicate projects for them. But the smaller to mid-sized healthcare facilities don't have those same resources, and they have to ramp up their systems the same way so that they can meet the needs of the industry in terms of what the federal government wants us to get to with achieving the triple aim of healthcare.
So their shortcut, it would be outsourcing to solution providers who can come in and really fix work.
Yeah, that's right, because they don't have a lot of internal resources, if any. Like a small to mid-size, take an independent physician practice or a group practice of 9 to 12 doctors. Most of those organizations don't even have an IT person. It's some practice manager or administrator that is doing some kind of mix of a job where they are doing a lot of operations stuff, but also have responsibility for the information technology. And I've been to some of these doctors' offices and group practices where their server room is basically a shelf with a couple of Cisco servers on top of a shelf in their men's room or their bathroom, and that's just not going to cut it. So they need help, and I think that's again where VARs and systems integrators can really lend their expertise to help these guys.